Hello, my name is Rika Lee. I am a nursing student in Liberty University's online Master's Nursing program. This presentation is a continuation of the role of the nurse leader in Quality Healthcare Project Part 2. Some of the objectives that will be discussed in this presentation are a reflection of the project from Portion 1. There will be a brief summary on the healthcare quality issue that was presented. There will also be current innovative and evidence-based recommendations for the quality issue that are new and or different from what is currently in place at my organization. There will be ideas about how the quality issue is responding to current interventions and how I would use an innovative idea to improve the quality issue. There will be potential risks that the team could face if a new method was utilized, and from a leadership standpoint, how I would mitigate the risk, how I would handle any errors that have occurred, and how I would monitor, improve, or change any innovations. And lastly, it will describe any ethical challenges that are involved with initiating any interventions to the current plan. Well, let's get started. Healthcare quality issue. Insulin preparation and administration practices are not in compliance with the Total Joint Commission. A brief background on Part 1 is regarding a quality area within the healthcare facility in which I work. During this year's Total Joint Commission, the organization received several citations regarding insulin preparation and administration. Prior practices involve a nurse utilizing a multi-dose vial to draw up insulin. Nurses would take a vial from room to room and draw insulin dosages at the patient's bedside. Total Joint Commission cited this practice as unsafe due to foul contamination, and there are no double check and or verification system of administering correct dosages prior to administration other than the current barcode scanning method. Drawing up insulin dosages and administering insulin at the patient's bedside is a practice that has been utilized throughout the entire hospital for years. The Total Joint Commission ordered the hospital to develop an action plan that would meet their guidelines and expectations. This process will help the hospital acquire accreditation once fully compliant. Medication error. A medication error is any avoidable event that can cause the improper administration of a medication to a patient, according to an article produced by Chowdhury and Chakraborty of 2018. A remediation plan. The organization developed a plan to prevent contamination and reduce medication errors. Nurses are to now draw insulin up in the medication room in the presence of another nurse. Both nurses are to verify the dosages, and a label is to be placed on the syringe. Both nurses will then go into the patient's room to administer the medication. Continuing the plan in action, a barcode scanning system is to be utilized during the administration process. The witnessing nurse will verify the administering nurse's technique, and both nurses will sign the audit book verifying compliance according to the new action plan that has been set forth. A financial impact to consider with implementation of this new process. The financial impact of implementing this process is that it is more cost-effective for the organization in comparison to providing individual insulin pens. Multi-dose vials can be used for more than one patient, therefore saving costs on purchasing individual insulin pens for each patient throughout the organization. Is this quality issue relevant? This is an important healthcare quality issue that Total Joint Commission targets in several healthcare facilities throughout the United States. The hospital is working very hard to remain Total Joint compliant and acquire full accreditation by adhering to these new set forth policies and procedures. The role of the nursing leader. The role of the nurse leader is essential for departmental compliance. Every departmental unit manager is responsible for making sure that their employees are adhering to the new hospital protocol regarding insulin preparation and administration. Each day, unit managers should verify that their audit books are compliant and each section has been completed adequately and accurately from each nurse, and that is the administering nurse and the witnessing nurse. Leaders help in ensuring the hospital is remaining Total Joint compliant. So, what are some evidence based recommendations that could be implemented to either replace or enhance the current policies or interventions that have been set forth? According to several authors from various different articles, pre-filled insulin devices, education on safe and appropriate use, creation of standardized protocols, and implementing single-use devices for patients are just some recommendations that have been proven to help and replace such practices. Advantages of using a pre-filled device. These include accuracy, sterility, and safety. Accuracy is based on the fact that pre-filled syringes or devices are created to deliver accurate dosages of a medication. Sterility is provided by pre-filled syringes, which eliminates the risk of exposure to outside surroundings because the medication remains inside the device at all times. And lastly, safety is practiced because pre-filled syringes avoids the need to fill a syringe prior to administration, eliminating the risk of contamination. Education strategies. According to the author Cornish of an article in 2014, education is essential for all members of the interdisciplinary team regarding proper preparation and administration. Employees should be provided the necessary tools to increase knowledge barriers in relation to proper glycemic control. These can be in the form of providing online modules for employees to complete, providing hands-on in-services that would demonstrate proper technique, and providing educational handouts. Single-use devices. Insulin pens should be utilized for one patient and one patient only, according to Paparella and Horsham, 2015. When dispensed, each insulin pen can be easily labeled with the patient's name, and use of these pens is ideal in that it requires less time for the nurse or other practitioner to prepare a dose. Innovative ideas as a nursing leader. As a nursing leader, I would definitely provide educational in-services, and for the inpatient care areas, individual insulin pens are a perfect consideration. The pens can be labeled with patient identifiers, and the pens will be stored in a designated refrigerator. Implementing educational in-services to demonstrate proper techniques for preparing and administering insulins are important. Individual pre-filled devices will allow for more accurate doses, prevent contamination, and promote safety practices for both patients and nurses. Lastly, implementing these practices will keep the organization compliant with Joint Commission by helping to reduce medication errors, maintain sterility, and reduce needle sticks. Preparation. Preparing insulin is an important step in the nursing process. Para-internal medications must be prepared in a clean, dry workspace that is free of clutter and obvious contamination sources, according to Dolan, Belizardo, and Patrick in an article of 2016 on page 752. Storing and preparing para-internal preparations in a secure location not only reduces contamination, but also increases patient safety. Responses to the current interventions that are in place. The healthcare quality issue is responding very well to the current SET action plan. The hospital is still performing audits for every insulin administration on every patient in every department. To educate staff, an email was sent out to all appropriate personnel on the new policy. Since enactment of the new protocol, the hospital has been in the upper 90 percentile as far as compliance. Implementing any new practices or innovations can present a risk factor. The main risk factor foreseen with implementation of purchasing individual pre-filled syringes is the possibility of an increase in financial costs. However, these devices would reduce the costs associated with needle stick injuries and also the cost of purchasing any new insulin vials if one vial was to become contaminated. This is just a consideration. From a leadership standpoint, the cost of pre-filled syringes would have to be evaluated and compared to the current practices that are in place to ensure that the hospital would not have a financial strain due to this new change. Error prevention. As a nursing leader, how would I mitigate error prevention? Well, any medication errors must be reported immediately. A thorough investigation will be performed to identify what went wrong. An intervention plan will be created to prevent future errors. And depending on the circumstances, such as repeated errors, many state licensing organizations require reporting to the licensing board, according to O'Grady and Porter of 2018, the course textbook. Each nurse is responsible for verifying the patient with 2 identifiers. Each syringe is to be labeled with appropriate information such as drug name, dose, the patient name, and date of birth, and also barcode scanning will be used prior to administration. How would I monitor improvements? Well, every manager currently receives a risk master for any reported incidents. This process will continue as well. Nurses must take responsibility for all of their actions, and if an error occurs, the nurses are expected to report the incident to the appropriate personnel and not to remain quiet. An ethical challenge concerning this change in nursing is honesty and integrity. Nurses must take responsibility for all of their actions. If an error occurs, nurses are expected to report the incident to the appropriate personnel and not to remain silent regarding the patient care issue. And a Christian worldview that could be applied to this situation is from 2 Corinthians 8:21, which states, "For we aim at what is honorable not only in the Lord's sight, but also in the sight of man." As Christian nurses and leaders, it is important to practice with honesty. Nurses are expected to do what is morally and ethically right at all times. Thank you, and this is just a continuation of the role of the nurse leader in Quality Healthcare Project, Part 2.